Welcome back to the BMD Ready channel. At BMD Ready, we help you understand your health so you're ready for the doctor. Today, you'll learn about 55 facts and 55 misconceptions about Alzheimer's disease. Are you ready? Let's go! Alzheimer's disease is a progressive neurological disorder that affects memory and thinking skills. It should not be mistaken for normal aging. Alzheimer's is the most common cause of dementia, accounting for 60 to 80% of cases. It is not the only form of dementia. Alzheimer's disease primarily affects older adults, but early onset Alzheimer's can occur before age 65. It is not always limited to the elderly. Alzheimer's disease symptoms include memory loss, confusion, and difficulty with daily tasks. These should not be mistaken for occasional forgetfulness. Alzheimer's disease progresses through stages, starting with mild symptoms and advancing to severe impairment. It is not a condition with sudden onset. The exact cause of Alzheimer's disease is not fully understood, but it is linked to plaques and tangles in the brain. It is not caused by a single factor. Alzheimer's disease is diagnosed using cognitive tests, brain imaging, and medical history. It is not diagnosed based solely on self-reported symptoms. Genetics, age, and family history are significant risk factors for Alzheimer's disease. It is not caused solely by lifestyle factors. Alzheimer's disease can lead to behavioral and mood changes, such as depression or agitation. It is not limited to memory loss. Alzheimer's disease is a progressive condition that currently has no cure. It is not a reversible disease. Alzheimer's disease treatment focuses on managing symptoms and slowing progression. It is not treatable with over-the-counter medications. Alzheimer's research is ongoing to develop new treatments and potential cures. It is not a fully understood disease. Alzheimer's disease can cause difficulty finding words or completing sentences. This should not be mistaken for normal pauses in speech. Alzheimer's disease can cause disorientation, leading to getting lost in familiar places. It is not always due to poor navigation skills. Alzheimer's disease can cause difficulty managing finances or solving problems. This should not be mistaken for occasional financial mistakes. Alzheimer's disease can lead to a loss of interest in hobbies or social activities. It is not always related to depression. Alzheimer's disease can cause physical symptoms like difficulty walking in advanced stages. It is not always limited to cognitive decline. A healthy lifestyle, including regular exercise and a balanced diet, may help reduce the risk of Alzheimer's disease. It is not entirely preventable. Alzheimer's disease is more common in women than men, partly due to longer life expectancy. It is not limited to one gender. Alzheimer's disease can lead to sleep disturbances or changes in sleep patterns. This should not be mistaken for general insomnia. Early diagnosis and intervention can improve the quality of life for individuals with Alzheimer's disease. It is not always diagnosed in advanced stages. Alzheimer's disease can cause misplacing items and inability to retrace steps. This should not be mistaken for carelessness. Alzheimer's disease can cause repetitive speech or behaviors. This should not be mistaken for habit formation. Alzheimer's disease can lead to delusions or paranoia in some cases. This should not be mistaken for unrelated mental health conditions. Alzheimer's disease is not contagious or infectious. It is not a condition that spreads between individuals. Alzheimer's disease can lead to withdrawal from work or social interactions. This should not be mistaken for personality changes unrelated to health. Alzheimer's disease symptoms can vary widely among individuals. It is not identical in all patients. Alzheimer's disease can cause difficulty recognizing familiar people or objects. This should not be mistaken for general inattentiveness. Alzheimer's disease can be linked to cardiovascular health, as heart and brain health are closely connected. It is not unrelated to overall health. Alzheimer's disease can lead to weight loss in advanced stages due to difficulty eating. This should not be mistaken for dietary choices. Alzheimer's disease may coexist with other medical conditions like diabetes or hypertension. It is not always isolated. Alzheimer's disease can cause individuals to repeat questions or stories frequently. This should not be mistaken for intentional behavior. Alzheimer's disease caregivers often require support and resources due to the demanding nature of care. It is not always manageable without help. Alzheimer's disease can progress at different rates for different individuals. It is not predictable in progression. Alzheimer's disease can cause loss of spatial awareness, leading to accidents or falls. This should not be mistaken for clumsiness. Alzheimer's disease can lead to difficulties in planning or organizing tasks. This should not be mistaken for simple forgetfulness. Alzheimer's disease can cause individuals to withdraw from conversations due to difficulty understanding. This should not be mistaken for shyness. Alzheimer's disease can be managed with medications to reduce symptoms temporarily. It is not curable with current treatments. Alzheimer's disease symptoms can include difficulty reading or writing. This should not be mistaken for declining literacy. Alzheimer's disease is associated with the buildup of amyloid plaques and tau tangles in the brain. It is not related to a single brain injury. Alzheimer's disease can lead to difficulty adapting to new situations or environments. This should not be mistaken for stubbornness. Alzheimer's disease can increase the risk of infections like pneumonia in advanced stages. It is not unrelated to overall health decline. Alzheimer's disease can cause a decline in emotional regulation, leading to mood swings. This should not be mistaken for personality traits. Alzheimer's disease research is exploring biomarkers for early detection. It is not yet preventable with a single test. Alzheimer's disease can lead to wandering or getting lost, even in familiar areas. This should not be mistaken for inattentiveness. Alzheimer's disease may involve genetic predispositions, such as mutations in the APOE gene. It is not purely environmental. Alzheimer's disease symptoms can include trouble handling finances or bills. This should not be mistaken for financial irresponsibility. Alzheimer's disease often requires long-term care planning and support. It is not a condition that resolves quickly. Alzheimer's disease is sometimes referred to as type 3 diabetes. While both conditions can involve insulin resistance in the brain, Alzheimer's is not diabetes, and diabetes is not Alzheimer's. Some individuals have dementia-like symptoms without the progressive brain changes of Alzheimer's. Not all dementia is degenerative and progressive like Alzheimer is. Some dementia-like symptoms can be reversible. Diabetes is considered a risk factor for developing Alzheimer's disease due to the shared nature of insulin resistance in the brain. The overall totality and severity of other contributing factors, like obesity and high cholesterol, all add to the risk. Aging can bring about some memory loss and slower cognitive function. Alzheimer's is not a normal part of aging because it involves progressive impairments that interfere with daily life. Eating a healthy diet may contribute to the arrest of cognitive decline and dementia. No specific food ingredient, or supplement has been shown to prevent or cure this disease. Adopting a healthier lifestyle and exercising, possibly adding a practice of meditation, may help prevent the onset of this disease. While cognitive stimulation offers hope, no fitness regimen or practice can claim to have prevented or cured Alzheimer's. In the final analysis, Alzheimer's disease is fatal. While this illness takes a long time to claim a life, the decline in memory, loss of body functions, and erratic behaviors will claim the patient in the end. Did you learn something new today? Please subscribe and share this video.